Welcome to Lecto. Today we are going to discuss meninges of the brain and the spinal cord. These are basically the three layers which protect both brain and the spinal cord. So these layers are, first one is the dura mater, which is the outermost layer. Second one is the arachnoid matter, and third one is the pia mater. Dura mater, also called Epi-pia Meninges, another name of the dura mater, and arachnoid matter and pia matter, both are also called Lecto meninges, combined name of arachnoid matter and pia matter. Here you can see this is the structures of the brain, and the outermost is actually the skin. Skin which is present over the skull is called scalp. This is basically the skin, specific skin which is present over the skull. Next is this is the skull bone. This is actually the bone. First is the skin, second is the skull. Next, if we move inward into the brain, then these three layers will present. First one is the dura mater. Here is the dura mater. It has two membrane. Dura mater has two membrane. First one is the endosteal layer, and second one is the meningeal layer. First one is endosteal layer and second one is the meningeal layer. Here you can see black area. These are basically this membrane is basically the endosteal layer. This is endosteal which is present outside, and innermost is the meningeal layer. This is the meningeal layer. These are basically the two membranes of the dura mater. But keep remember, these two membranes are separated at only certain areas. Here this covers the almost all the brain. But when it moves downward into the spinal cord, here is basically the spinal cord. When it moves towards the spinal cord, then it fuse and form a single layer. Right? So this is the layers of the dura mater. And here you can see, here is the skull bone and the dura mater. There is a space. Here you can see, this is a space. This one. The space which is present between the skull bone and the dura mater. This space is called the epidural. Epidural space. Above the dura mater, the space which is present above the dura mater is called epidural space. And here you can see, next layer is the arachnoid matter. So next is the arachnoid matter, second layer of the meninges, which is the arachnoid matter, and the space between the dura and the arachnoid matter is called subdural space. Here you can see this one. This is the subdural space which is present below the dura mater. Up till now we discussed the two layers, for two space. First one is the epidural space which is present above the dura mater, and second space is basically the space which is present below the dura mater, which is called subdural space. So here are basically the two spaces, and then second layer is the arachnoid matter. And third, next is the another space which is present below the arachnoid matter. So the space which is present below the, here is the space. This space is actually the subarachnoid space. So the space which is present between the pia, and here is the red color, is basically the, it is shown by the red color, is basically the pia matter. So space between the arachnoid matter and the pia matter is called subarachnoid space. So these are basically the spaces which is present between the layers of the meninges. So keep remember, last layer is the last matter is the pia matter, which has two layers also. Here is the pia matter also has two layers. First one is the Epi-pia and second one is the Pia-glia, or you can say Pia-intima. So these are basically the two layers of the pia matter. Dura matter also has two layers, and arachnoid matter has only one layer, and pia matter has two layers, Epi-pia and Pia-glia, or you can say Pia-intima. So these are basically the general overview of the three layers of the meninges. Next we will discuss first of all dura matter in detail. As you can see, we discussed dura matter has two layers. It is separated at certain parts of the brain, and when we move towards the spinal cord, it fused to form a single layer. So up till now, this is the dura matter. So important point is that the space which is present between the two layers of the dura matter has space, and it has sinuses, venous sinuses. So first of all, we will discuss the basic difference between the veins and the sinuses. There is actually a difference between vein and sinuses. Veins are simple, has low diameter, small diameter, but sinuses has large diameter, and it has thin membrane relative to the vein. So between the two layers of the dura matter, there is a space, and in this space several venous sinuses are present. So first of all, we will discuss the sinuses, and then we discuss its coronal section. So we will discuss the venous sinuses of the dura matter. So these are called dural venous sinuses. So first, which is present upper part of the brain, is actually called the superior sagittal sinus. So this is the sinus which is present at the upper part of the brain. Next, it will move toward the posterior part of the brain, or you can say dorsal part of the brain, and at that there is a junction. You can see red dot. There is a junction which is called confluence of sinus. Confluence of sinus. This is actually the junction between the sinus. From this junction, further three sinuses will evolve. So at the posterior part, there is a sinus which is called occipital sinus. Why do we call it occipital sinus? Because at the posterior part there is a bone which is called the occipital. So on the basis of the bone, we call this sinus is occipital sinus. Next, further two sinuses will also evolve, and these are basically the this one. This is the right transverse sinus, and here is the left transverse sinus. So these are basically the left transverse sinus and right transverse sinus. Next, it will further there is a curve. Here is curve, and these curve also form another sinus which is called sigmoid. Here is a sigma-like structure. So you can remember it as sigmoid, just like the there is also a curve present between the large intestine. So you can remember from the large intestine that there is a curve last part before the rectum. There is a sigmoid structure. So here is also a sigmoid structure, and which is on the basis of this we called it sigmoid sinus. Both sides, on both sides, here is the sigmoid sinus. And last, it will drain into the internal jugular vein. Last, it will drain into the internal jugular vein. So this is the last part. So, from the junction, 3 sinuses will evolve. And here you can see, at the left transverse sinus, you can see there is another sinus will evolve, and this is which is shown by the blue color. This sinus, I'm talking about this sinus. This sinus is basically called the straight sinus. This is basically the straight sinus which evolved from the transverse sinus. And straight sinus further divide into 2. This bluish area which is below the superior sagittal sinus, this is called inferior sagittal sinus, which is present just below the superior sagittal sinus, is also called inferior sagittal sinus. And here is the, which is shown by the red color, is basically the major cerebral vein. This is vein which has relatively smaller diameter as compared to the sinus. So you can see from the transverse sinus, 2 branches of other sinus will evolve. So this is, I am talking about this green color. This sinus is basically called the Petrosal sinus. Above the, if the sinus is above, then it is called superior Petrosal sinus, and if it is present below, then it is called inferior Petrosal sinus. Here there are 2 sinuses. Upper is the here superior Petrosal sinus and inferior Petrosal sinus, and from this is from the right transverse, and same left transverse also evolved 2 sinuses which is called inferior Petrosal sinus and inferior, and both these Petrosal sinuses will drain into the another sinus, 2 sinuses, right and left, and here is the cavernous sinus. These are the 2 sinuses which is present at the anterior part of the brain. And in between cavernous sinus, between the cavernous sinus, there are another 2 sinuses. These are actually present in the pair. These are 2 sinuses which join the cavernous sinus, is called intercavernous sinus. Intercavernous sinus which join the 2 cavernous sinuses. So from the cavernous sinuses to, from the right and left sinuses, cavernous sinuses, 2 sinuses also evolve. These are called Spheno-parietal sinus. We call these sphenoid and parietal bone. So this is actually right and left. So this is the Spheno-parietal sinuses which are evolved from the cavernous sinus. So this is basically the general overview of the sinuses which are present, keep remember, between the 2 layers of the dura mater, which for uppermost is the endosteal and innermost is the meningeal layer. So next we will see that Another important point. Upper layer of the dura mater, which is called the endosteal layer, has no folds. But meningeal layer has some fold into the brain. It will move inside the brain and form some structures we will discuss here, which is called the folds of meningeal layer. I am talking about meningeal layer, which is actually the part of the dura mater. Four folds will derive from the meningeal layer. First one is the fox cerebri. Second one is the tinctorium cerebelli, and fourth one is the fox cerebelli, and last one is the diaphragma sella. So these are basically the four folds of the meningeal layer. So here you can see this is the structure of the brain. This is the anterior part. This is the posterior part. This is the superior and this is the inferior part of the brain. If we cut from the posterior part, in what section? Coronal section. Here you can see this is the brain. If we cut this way, no. Here you can see this is the brain, and if we cut this way, coronally, this is the sagittal sinus, sagittal plane, this is the coronal plane, and this is the horizontal plane. We cut this way, and from the posterior part, here you can see we cut it this way, in this way, and after cutting we cut three pieces from the anterior, middle and posterior. Here you can see, let's suppose this is the brain, this is the brain, this is the anterior part, this is the posterior part. If we cut it coronally and we cut three pieces, here you can see we cut three pieces of the brain in coronal section, and this is actually anterior, from the anterior part, which is called the anterior, and this is the middle and this is the posterior. We cut three pieces, anterior, middle and posterior. These are the three pieces, and here they look like this. This is basically the anterior, this is basically the medial, and this is the posterior. Anterior will look like this, middle will look like this, and this is the posterior. So first of all, we count the three layers of the meninges. Here is the outermost is the dura mater, which is shown by the black color. Here is the black color, and next is the, which is shown by the blue color, is the arachnoid mater, and last one is the, which is shown by the red color, is the pia mater. So dura mater, arachnoid mater and pia mater. So you will see that the upper endosteal layer of the dura mater is smooth. Here you can see this is smooth in all section. But the inner layer, which is called the meningeal layer of the dura, has some folding inside the brain. Here is the brain. Some folds inside the brain. So inside the, here is the arachnoid mater will also form the fold, and pia mater will just move along with the meningeal layer of the dura mater. So here you can see we have discussed that the sinuses will present in the between the two layers of the dura mater. Here you can see these are the two layers, and we cut these sinuses also because sinuses are present in the brain. And here you can see these sinuses will look like this way. These sinuses look like in this way. So you can see, first of all, this fold is called the fox cerebri. This is the first fold of the meningeal layer, and these two are basically called the tinctorium cerebelli. These are the two folds. So this is the fox cerebri, this is the tinctorium cerebelli. And tinctorium cerebelli, here you can see it we divide on the basis of the tinctorium cerebelli. We divide the brain into two parts: superior tinctorium and the structure which are present below the tinctorium cerebelli is called the inferior tinctorium. Superior tinctorium and inferior tinctorium. And here you can see the sinus which is present in this fox cerebri is the superior sagittal sinus, and another sinus, here is the, and below there is a straight sinus, and here is the straight sinus also. So two sinuses will prominent in the anterior part of the section of the brain. First one is the superior sagittal sinus and second one is the straight sinus, and these are prominent. Here you can see, don't get confused, because you can see this is right this way. If I cut this marker this way, then it will look like this. And same here is the structure of section of the brain. And here is the tinctorium cerebelli, and these sinuses will be transverse sinus. We have discussed that there are two sinuses, two transverse sinuses, right and left, and here is the right and left, two sinuses of the transverse. This is the fox cerebri, and next we will move toward the middle. We got the second part of the second section of the brain is the middle. Here you can see this is same. This is the superior sagittal sinus. This is the transverse sinuses, and this is the straight sinus. And here you can see which is present at the inferior part, which is this sinus. Another sinus will be occipital sinus. Occipital sinus, which is present at the inferior part of the brain. So these are the superior sagittal sinus, these are the transverse sinus, this is the straight sinus, and this is the occipital sinus, which are prominent here. So next we will move the posterior sinus. This is basically same here, but you will see that there are every section is different from each other. So here you can see this last, this is the fox cerebri, this is the tinctorium cerebelli, and this fold of the meningeal is actually called the fox cerebelli, cerebrum, from the cerebrum. So up till now we discussed the three folds: fox cerebri, which cut the right hemisphere from the left hemisphere. Second one is the tinctorium cerebelli, which divide the brain into superior tinctorium and inferior tinctorium. And the fox cerebelli, which is the third fold, actually separates the cerebellum. Here actually this is the two cerebral hemisphere, and this is the two cerebellum. So these are the four different parts of the brain. So these folds basically divide the brain into different parts. And the last one is the diaphragma cella. These are not prominent here. You can see this one. This is actually the pituitary gland. This is the pituitary gland, and this pituitary gland, here you can see this is the dura mater. Dura mater folds towards the pituitary gland. Here is the pituitary gland, and dura mater fuse like this way. You can see this way. These folds form covering around the pituitary gland, and these folds are actually called the diaphragma sella, and these folds are not prominent in these sections. This is this way. So these are basically the folds. We discussed 4 folds: Fox cerebri, Tinctorium cerebelli, Fox cerebelli, and last one is the diaphragma sella. So next is the arachnoid matter. Arachnoid matter, here you can see this is the arachnoid matter. This is actually called the cobweb. Cobweb because it has several trabeculae, which show it like cobweb, spider web. Just they look like just spider web. These are basically present in the arachnoid matter. Another important point. There are 2 important things. First one is the villi, arachnoid villi and arachnoid granulation. Arachnoid granulation. These are basically the folds. Here you can see these arachnoid matter form folds. Here is a small folds. If the folds which will fall into the dural between the 2 layers of the dura, and if the size is small, then it is called arachnoid villi. But with the passage, when the human get older, then these villi will increase in size and form the arachnoid granulation. And the cerebral spinal fluid actually present between the subarachnoid space, which is present between the arachnoid and the pia mater. So here is the space in which the cerebral spinal fluid, 3 things present: cerebral spinal fluid, nerves, and the vessels are present. Cerebral blood vessels are present in this space, which is called the subarachnoid space, and this fluid can also drain into the sinuses. Cerebral fluid also drain from the arachnoid granulation into these sinuses, and from these sinuses it will fall into the and it will move towards the brain through the internal jugular vein. So this is the arachnoid matter, and last is the pia matter. Pia matter has 2 layers, Epi-pia and Pia-glia. So important thing you will have to remember in the virtue Robin's perivascular space. So you will have to remember Virtue Robin's perivascular space. What it is? So it is actually, you can see here, you can see this is the actually the pia mater. So and this is the arachnoid matter. This is the pia mater. This is the arachnoid matter. This is arachnoid and this is pia mater. And this one, this is the part of the brain. This is the brain. And here you can see what things are present in the subarachnoid space. 3 things: cerebral spinal fluid, nerves, and the cerebral veins. So here is the vein which is present in the subarachnoid space. Large vein. It will branch and fuse inside the brain by crossing the pia mater. Pia mater is pierced by the veins. So here is actually cross the pia mater, and pia mater will also come along with this vein, move this way. So, and here you can see this is the brain. So Virtue Robin's perivascular space is that space which is present between the brain and the vessel and the veins. So the space which is present between the brain and the veins of the blood vessel is called perivascular space, and these veins, your blood vessels, carry pia matter along with them, and the space which is created between the brain and the vein of the blood vessel is called the perivascular space. So this is all about the three layers of the meninges. If you have any question, then you may ask in the comment section. Thank you.